but they have to understand if they want a result, particularly when someone comes there and they've seen everyone in town. She's 58. She's had filler lips, cheeks, nose.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Aleta Sloan, a PA for 35 years in internal medicine and cardiology, and the first PA on the coast of North Carolina. She is a KOL for Cartessa, Candela, and Aclaro, speaks frequently for Cartessa, and offers online courses in resurfacing treatments. She is the owner and CEO of United Medical Anesthetics and hosts a weekly Wavelength Wednesday. She also trains plastic surgeons, dentists, dermatologists, PAs, NPs, and RNs on lasers, microneedling, and injectables. So, Aleta, welcome and glad to have you here.
Well, it's so great to have you have me here, Daniel. Thank you so much. I'm excited about this.
Yeah, me too. So let's dive right into it. How
Yeah.
did you first get interested in aesthetics?
So as you mentioned, I was the first PA ever to get privileges in Eastern North Carolina, and I always wanted, when I graduated, to do dermatology. But in my small town of New Bern, there was no dermatologist. So I took the only job that was offered, and this is again 35 years ago, which was in emergency medicine or the ER. So I did that for 5 years, and then I got sucked into the internal medicine cardiology world for the next 30 years, well, 25 years. And I just finally, after COVID, made the jump to do something I've always loved to do. So I've kind of maxed out how much I could make and do and prove that PAs were great addition to the medical profession. Because again, 35 years ago, no one knew what a PA was in New Bern, North Carolina. So I felt I achieved what I could, and starting my own practice and doing something I loved at the age of, I think, 52 or 54 at that time. I made that jump into something I knew I've always loved, which has really been skin.
Got it. Now that you have this practice, can you discuss what are some of your most common treatments that you offer to your clients and your patients?
Personally, I always start with their skin. So I make sure they're on the best products. I do believe the studies prove that vitamin C is beneficial as a UV protectant, an antioxidant. It helps suppress tyrosinase and pigment in the skin. It helps some facial redness and collagen, although I don't sell it for that. But I make sure they're on my non-negotiables, including a vitamin C and the proper sunblock, the proper amount of sunblock, and reapplying. And then always all of my patients are going to be placed on some sort of retinol, most likely prescription. We will use some retinaldehyde products to start them off. They're a little bit more mild and then build them up. But we always start with skin because I think as we talk about the topic of today of the make under, people want natural results, and treating the skin is always going to be the best benefit. Because even if you do lips and cheeks and you don't have pretty glowy skin or sun damaged photo aged skin, you're not going to look as more youthful and happy with your results if you have bad skin or wrinkled skin or photo aged glycated wrinkles above the lips. So we in our practice always start with your skin and then we build from there. Yeah, other treatments. I nicknamed the Laser Queen. I have about 14 devices. So again, we're really into the make under. We want to tighten skin naturally through either radiofrequency microneedling or regular microneedling. We have the Virtue RF through Cartessa, where we have had incredible results. We have the microneedling Exceed from Candela, which is not using heat, but can really build that collagen in the dermis and tighten skin naturally when it's a lot of facial laxity. Then we do incredible resurfacing treatments. So in my practice, we always start with, to answer your question, really good skincare that is proven. So my slogan is where medicine meets beauty. We're going to use products that are proven because most products that are used are cosmeceutical claims. And we really use science-backed, studied, FDA-approved medications. And we use Obagi has been a company that's been skin inclusive from the beginning, uses FDA-approved protocols for pigmentation and photoaging. And we stick to our slogan where medicine meets beauty and really approach the skin from a medical background. Again, me being in medicine for so long, I don't know how else to treat outside of proof and FDA approved drugs that are safe and effective. After we treat the skin, then we do a lot of lasers and microneedling. We do a lot of resurfacing with CO2. And then we fill in bone loss with fillers and biostimulators.
Got it. Now, you brought a couple different points in here. You talked about people looking for that more natural look, which is what I'm starting to see when I talk to lots of practitioners all across the country. They're just seeing that people are moving more in this direction. They want to have that natural look. They don't want to have that overdone look. But you also kind of brought the point of the make under look, which is the opposite
Yeah.
of the make over look. So could you talk a little bit more about the make under look? Like, what is it and why is it so much different from what people think about with the make over look?
Exactly. I think for sure the Kardashians have always kind of led this PRP vampire facials. They've been pretty proponents for these humongous bottoms and a lot of overdone stuff. I think that's definitely fallen way out of popularity. I've only been in aesthetics for 5 years, but I have also seen a dramatic shift. Everyone that sits in my chair says, I don't want filler. Or I can say 80% say that. I can't say everyone. Because once I educate them that when there's bone loss, only certain things can improve that, like biostimulators gradually building collagen and elastin and giving volume, or using where there is deep volume loss, say per se in the piriformis area, filler may be needed. But the movement, I think, is the less is more movement. The make under trend is definitely a shift towards more subtle, more natural looking cosmetic treatments. I think the shift is people do not want to look overdone for sure, but they almost don't even want to look done anymore. The less is more is definitely moving in, and I'm so glad I got into lasers. I started my practice with 3 lasers, and I've always been into skin quality. I've been less of a filler user, and I was I think I arrived a little bit before the time or the shift in all these fillers. But patients are pushing definitely for more natural looking results. They want to look their age. They don't want to look younger anymore. They don't want to look like someone else. They want to look good, but not again overdone. So I think the rise of the redo of overfilled patients wanting to come into practice, and actually I have dissolved a few, I've only done it twice, but dissolve full face. People want all that filler out of their face. So that's definitely a big change. Lips are a great example. Overfilling your lips are out. People are now just tweaking their lips for like subtle like symmetry or hydration. Even the big plastic surgery breast augmentations, less is better. People are really pulling their breast implants out. I'm not in plastic surgery, but people in my chair treating their face will briefly, we get their past medical history, and a lot of them have had reversal of even their breast implants. So I think the undone look natural is here to stay, and using products like exosomes, growth factors, PDRN, um, secretome stem cells, and exosomes and regenerative medicine is definitely on the rise, and everybody's using it and loving it.
Yeah. Now you mentioned that you're known as the laser queen. So if you could explain like what's the main difference between coming in from the laser perspective, like helping people look either maybe not necessarily younger, but like better skin quality and all that, versus the filler side. So if someone's coming, it's like what's the difference between laser and filler?
Mhm.
How would you explain or how would you answer that question?
Well, I think the difference is laser treatments can actually regenerate collagen and elastin without any abnormal substance. So energy devices like microneedling, erbium lasers, CO2 lasers, even IPL, they can rejuvenate skin all at different levels. And it's completely different than a foreign body. Fillers are considered a surgical procedure, and there are complications with those, as there are with lasers. So when my patient comes in, they probably need both, to be honest. But I think the shift in the under, what I call the make under movement, is people are more willing to invest in their skin and regenerative properties like lasers when they understand that I could put big cheeks in them, or I could, well, not big cheeks, but I could do their cheeks and their chin. But if they have crappy skin that's wrinkled and glycated and crusty and dry and pigmented and red, all the filler in the world is never going to look good. So in my chair, I think the difference I explain to the patient is you may need both. They both work together wonderfully because lasers are resurfacing the skin or tightening the skin to some degree. They don't lift the skin. There's a difference. That's through a facelift. I never promise that you're going to get a lift from a laser. That's through plastic surgery and a facelift. But I think the big difference is understanding that both are needed. I'm really not against filler because for moving again forward, the make under is also doing less is more, but it's not, it's doing less, but of the right treatments. Because it still takes lasers, microneedling, skincare, and filling in with biostimulators and filler to give you that full facial rejuvenation. And I think that's another thing in the make under move, in my opinion, that people are wanting to look more natural. So it may not be just doing a big lip. It may not be just doing their cheeks. We're now, famous injectors all over the country are really educating and sometimes won't even treat you in some instances if you're not going to do a full face rejuvenation, meaning addressing the temples where there's bone loss or the preauricular area where there's bone loss. They're not going to say, I'm just going to do 2 syringes. Some really good injectors that I know will not do anything but a full facial rejuvenation because it looks more natural. So the difference is lasers are going to treat natural collagen production without any foreign bodies in your face. And those are good choices. I have patients that will just do a CO2 and it does almost everything but fill in bone loss. It's an incredible treatment, but I educate them that fillers are needed if the chin is recessed, piriform temples or preauricular area, that they need both. So I hate to say it's one against the other, but they are different and they should be done together, in my opinion.
Okay, great explanation then. Now, you also touched on regenerative medicine, which I think is also one thing that is starting to come up and more likely is going to be the future of aesthetics. But for people who don't know, could you explain what is regenerative aesthetics and what do you think is really the benefits of it?
Regenerative aesthetics, it can include multiple products and procedures. Regeneration is using your own body's power to heal itself and produce its own beneficial products, for lack of better words. So, for instance, if I give you Sculptra, Sculptra is going to go in, it's poly L-lactic acid, it's a foreign body, and you're going to build collagen around that. That product's going to break down and you're left with your own collagen. So, to answer your question, biostimulators or regenerative medicine is using products that are going to stimulate your own cells to build more collagen, elastin, and hyaluronic acid. So the difference between a hyaluronic acid and a biostimulator is a biostimulator is going to stimulate your own cells to produce good things. And filler is just that. It's sitting in as a little prop and it's going to do its thing propped up and it'll biodegrade over time and you'll need more. It's kind of like you buy that and you got to buy more. When you're doing biostimulators, you're investing long term. Now, most biostimulators will say they last about 18 months, and they do, but they also produce your own collagen. And yes, you get to take that with you forever. So biostimulators are a long-term investment. You're not renting them per se, is kind of what I've liked to explain to my patients. Now, that all depends, of course, on how much sun protection and other things you do to protect that filler or biostimulator, because we do know that UV damage, UV radiation is going to biodegrade neurotoxins, filler, and biostimulators. So sun protection is by utmost the most important thing that you can do for anything on your face or your body. So biostimulation or regenerative medicine is going to be used in things like Sculptra and Radiesse, Derma PRP filler, where we spin your PRP down and make it into PRF, or we spin it down even more and chill it and heat it to make it into a filler. I do a lot of Derma PRP filler because people do not want filler. but they need it. Remember, I said there's places on the body that you need filler, that all the tightening in the world, even a facelift, will need filler. That's why they do fat transfers with facelifts. Even lashes and brows. I think these big lashes are a thing of the past. I think they're a little overdone and scary for some people. And we use a lot of natural lash serums and brow serums because having loss, I just love the little things. The lateral brow on women is very thin and it's very aging. It can also happen with hypothyroidism. So I love to do regeneration with Derived on the scalp or lashes with the Obagi serum to truly just give that natural look, to restore what you had before and not look different. So I love regenerating your own growth of your hair through these serums. I love regenerating your skin through derma PRP filler or PRP or PRF. There's also other little things you can do, such as little drops in your eyes to give your eye a lift. But for back to biostimulation, I think Sculptra, Radiesse, exosomes, Regerin, which I don't even know I'm saying that. That's salmon DNA that actually helps promote collagen and elastin hydration in the skin. We use VAMP, which has vitamins, amino acids, minerals, and PDRN for skin rejuvenation after microneedling. We do not inject it because it is against the law, but we also include exosomes, growth factors, stem cells, and it's exploding to secretomes, which are a biologically driven regenerative product that's the newest that I've never heard of. But I know that that's something new within regenerative medicine. Not to mention hormone replacement therapy, also treating yourself from within. So wellness has become exploding on the market with med spas or aesthetic practices because you do want to treat your whole self. So, and I'm a strong proponent for exercise and eating right for sure.
There you go. So having it all together in one
Yeah.
all holistic package. Now, Alita, I'm curious, when it comes to weight loss, like we hear about these GLP-1s, semaglutide, tirzepatide, all these ones out there. And I've heard kind of mixed things about it. Like if you really are struggling with weight loss and you have a lot of weight to lose, I've heard it can really work a lot of wonders. But there's also the other side of it that if you've never worked out in your life and you take this, you start losing a lot of muscle mass, which leads to a whole host of other issues. So what's your thoughts on this? Like, could you dispel kind of like some of the confusion that surrounds GLP-1s?
Yes. So GLP-1s, I've been in medicine, as you know, 30 some years, are the most successful drug ever for weight loss. It's an incredible drug used in the right proponent or right patient by the right provider. Because if you're not educated on the contraindications or complications, it could not be. But it's an overall very safe drug. It is a drug that has extensive benefits, not only in biomarkers like your cholesterol level will drop, your blood pressure level will drop, your LDL will drop, your HDL will go up, your glucose and A1C levels improve, your fatty liver will improve. I can go on forever. The benefits are the drug got approved for diabetes, then weight loss, then it got approved for reducing cardiac events. So if you had heart disease and we put you on a GLP-1, you were going to have, I think, don't quote me on this, around an 18% reduction in recurrent cardiovascular events. Why is that important? Because the number one killer in the United States, and let me put women are in that, is still cardiovascular disease and heart attack. So if I said to you, you aren't going to die of this or that, but you're most likely going to die of a cardiovascular or heart attack event, this has been proven by the FDA to reduce recurrent cardiovascular events in patients with known coronary artery disease. It also has a 20% reduction in stroke. Now, if I said to you, you've had a stroke and you take this pill, you're not overweight and you're not even diabetic, but I give you this GLP-1 inhibitor and you have had a stroke. And by the way, if you're lucky, you didn't have any complications from your stroke or being disabled by the stroke, that's a good thing. But most people have devastating strokes that lead to them being in a wheelchair, not be able to walk or talk or use their arm. And I've seen that many years. So GLP-1s showed a reduction of risk of stroke at 20%. So it's a very advantageous drug. So with that being said, what are the risks? And how does it affect our industry in the aesthetic space? The risks are obviously GI are number one. People are not told that they shouldn't take the medication 2 weeks before an elective surgery where they're being put to sleep. So they're aspirating and dying. So it's very important. I see people sit in my chair and they were on it from another practice and they were never told to stop it 2 weeks before a procedure and even sometimes up to a month. So if you're having a colonoscopy or any procedure, dental, you have to stop this medication 2 to 4 weeks and let your doctor know. The risk I won't go through because we're not talking about that, but how does it affect my practice in the aesthetic industry? I can speak for my practice. If you start it, we make sure you're on enough protein. And I've been kind of bad about starting regenerative procedures like microneedling for Ozempic face. We have physique because with these GLP-1 inhibitors, you lose all over weight, but you don't lose pockets of weight. So women come in with bra fat, armpit fat, localized belly fat on the sides of their hips. And we have the Physique 360 that has been really helpful in patients who end up having either liposuction for these pockets of fat and or can't afford liposuction or don't want the surgery. There's body tightening devices and body muscle and fat burning devices out there to help Ozempic body and Ozempic face. But I think the industry, some med spas, I think, are really good at getting you on a program and a membership where you're getting your B12s, where we're getting you, we sell pharmaceutical grade vitamins. We're getting ready to start a vitamin injection bar. I'm not big into IVs because of you have to be very well trained, I think, and managed for IVs, but the Ozempic craze definitely can cause muscle wasting if it's done right and done with enough protein and given exercise on a regular basis. But there is still going to be some sarcopenia related to it or muscle loss. There's just going to be. But it's very important to monitor that patient and be sure they're not getting too thin on the medication and that you see them every 3 months. So it's a real thing. Ozempic face is almost everywhere. And that's where filling the face with not a lot of hyaluronic acid, but doing procedures like microneedling, lasers, and biostimulators are going to help these Ozempic faces and bodies, because a lot of these biostimulators can also be used on the body, are going to really help that patient not have so many complications once they lose their 20 pounds. Most people are going to lose 20 pounds on it or 24% of their weight. Women complain a lot about upper arm wrinkly. I see this every day because they've lost 20 pounds. So we use a lot of Radiesse on the body. We also use a lot of sculpture on the face and body. And we do a lot of adjunctive treatments for pockets of fat, tightening muscle, and a lot of support with vitamins, minerals, protein, exercise, and most importantly, I think close follow-up. And I will say this last thing, that I think it's really important that you see a medical provider. These online things I think are scary. I just think that you need, how do they examine your thyroid? If the number one black box warning on semaglutide is thyroid adenomas, how am I going to check your thyroid on a Zoom? How do I know you're safe? How do I know you don't have an adenoma? I've injected people's platysma bands and I've noticed they have a goiter. They have no idea about it. So I think it's real important to see a provider.
Well, you dropped a lot of great knowledge on all these different topics. So I'm sure that you get a lot of misconceptions. You hear a lot of myths from your patients about all these different treatments. So what are some of the most common myths or misconceptions that you tend to hear?
Well, the biggest one is filler is going to make you look fake. And I think if done right, is not. That's probably the biggest misconception. Another misconception is truly not understanding the risk involved when you get filler. I don't think most providers educate the patient that they could have a vascular occlusion, nor do I think most providers even know how to treat a vascular occlusion or have a protocol. I think that's gotten way more popular, but I don't think that everyone knows how to treat it. And I will use myself as an example. I thought I knew how to treat it until I had one. I didn't have it on a patient, but it happened to me. And I thought I knew because I had the protocol. But when it really happens to you, you have that protocol. The protocol says inject Hylenex into the area of the vascular occlusion. Well, do you inject where you think the area of the occlusion occurred. Well, what if you now have all of this levator reticularis all over your face? What area do you inject? So it gets down to really having a provider that can treat those complications. So I think a big misconception is filler makes you look face, and people don't understand how serious the complications can be with filler if you're not seeing a provider who can recognize it, hopefully before you leave, or treat it. Another misconception, this is my third one, is one treatment is going to fix it. I just had a consult this morning of a 58-year-old female who said nothing ever works, nothing ever lasts. And I said, well, let's talk about facial aging from your skin to your dermis and collagen to your bone. The reason is if you get this and this done, just your chin, you didn't treat your preauricular facial laxity in the lateral face, and that's probably why you didn't get results. So it really, I think, takes multiple modalities to give results that are non-surgical. I think the biggest mistake for my patients is definitely they think it's going to be one or two syringes and that's it, or it's not going to be lasers and microneedling and skincare and filler.
Mm.
I think the misconception is I think I can drop $1,000 and get everything done. It's to get results, unfortunately, it's going to take multiple modalities. And so I'm very honest with my patients. Listen, this is what you have. And I show them this is where your bone loss is. This is where your laxity is. This is why you have fat pad descent in your mid face. And if we start here, this helps the nasolabial folds. You have piriformis loss. So when I talk about those things, I try not to overwhelm the patient by any means, but they have to understand if they want a result, particularly when someone comes there and they've seen everyone in town. She's 58. She's had filler lips, cheeks, nose, uh, rhinoplasty, and all the other things. And she's never happy with those results. And I think it's important in her misconception. She said, well, my tox doesn't last for 4 months. And I said, well, there lies the problem. Tox has only ever been proven to really last 90 days. So educating that patient, understanding that they need more than one treatment to get the result they want is the most obvious misconception I see in my practice.
Got it. And thank you for shedding light on that. Now, Aleta, I'm sure that you've run into a lot of challenging cases throughout your career. Is there one story that really stands out in your mind, or just a kind of a really tough case, or one that you remember, and how you were able to get them a successful outcome in the end?
I would say that would be me because I went and had filler done by an injector of 10 or 12 years, and I had a bad complication, the one that we all dread. It was a vascular occlusion. And that's where I learned, I thought I knew how to reverse it. What did I learn from that? And I can tell you, denial is number one. Denial on the injector part, saying, oh, it scared me, but it looks okay. And then me denying or not wanting to complain how bad I hurt. I'm so glad it happened to me because I realize it's like a heart attack. You deny it. Like I had severe pain where I was injected. I didn't say anything. She saw a flash of white and said, oh, you're scaring me, but it went away. I didn't tell her how bad it hurt. We went to lunch. I had jaw claudication because no blood was getting, obviously, I had an occlusion. No blood was getting to my masseter muscle. And what did I learn from that? I learned that I called so many. The next day I woke up, I knew 100% sure. I had ignored it. I thought this is going to go away. I woke up with a thing called levator reticularis, where my whole left side of my face looked blue and red. And within 24 hours, my skin started to break down with ulcers. And I went to work. I had 3 patients in a row. I had to treat them. And I had 2 little angels come in my office that are reps and get me to a plastic surgery's office. I will say, unfortunately, no one really knew other than to stick me everywhere to put Hylenex in it, but we didn't know where. I didn't either. I'm not blaming anybody. I didn't know whether I should go deep. Should I go superficial? Should I go where I felt the initial pain of the injection, where I knew that it happened? Because my whole face was now red, blue, and breaking down. It took 26 vials of Hylenex over 3 days in a hyperbaric chamber to get my skin better.
Wow.
No long-term sequelae from that. However, my face, I've had to put hyaluronic acid in there, and it's never really looked as good as my right. So, but what did I learn from that? The I learned to reach out to people I've trained with, like Julie, who's in Oregon, who has an incredible uh, um, anatomy course that's 3 days that I spent with her after this happened. I was determined to figure out how best to avoid occlusions, which I was practicing using cannula over needle, but I took her course and I had that relationship with her that after my event, and no one in my area knew how to treat it. Okay. That's sinful. It is because we're injecting these every day and we're making lots of money, but we are not able to fix these problems. I feel like I've bought an ultrasound and a mind ray. I've trained with the leading Leone Shelke and A2 Aesthetics in California to learn how to find these complications and treat them quicker. So that complication educated me on really that no one knew how to help me, even plastic surgeons. We don't know really how to help people. I was going to start an emergency. Hey, call me. We'll take this ultrasound with us. We'll help reverse it, which 2 months later, I helped a physician reverse a vascular occlusion with this device from my experience. So I think I don't want to lose my train of thought. But the other thing that I learned from that event is I got all the recent protocol. I reached back out to Julie, who's been an educator and an injector for 20 some years, who also, as an injector, had a vascular occlusion. So it's rare that when you're on both sides of the seat, the chair, and we did a live webinar on how to treat a vascular occlusion. Once I gathered months of information, I hosted an event that was supported by an injecting company here, a large filler company. And we hosted 40 people that were local injectors. And I went through step-in-step protocol of exactly how to approach a vascular occlusion.
Fantastic. Well, I mean, as you mentioned, when you're on both sides of the chair, it's like you really learn a whole lot more, especially when things go wrong. Now, when it comes specifically to your
Exactly.
practice, I'm curious, what is your vision for United Medical and Aesthetics?
Gosh, I always want to put safety first. My pillars are safety, results are super important to me, and then education. So moving forward, no matter what I do, I really want to be the safest as I can be. And I will do very aggressive CO2 treatments that I think are rarely done on the entire East Coast because I know I can handle those complications. So moving forward for United Medical Aesthetics, I think because of my medical background, I'm going to bring back some wellness. I started out with weight loss and cardiovascular risk reduction and a bunch of healthy, your genetics and deciding what vitamins and all of that to choose regarding specific genetic markers that you have. So I think I'm going to move back into that. But right now, I only have one employee. I've grown very slowly over the last 5 years, but moving forward, I would love for United Medical and Aesthetics to grow to more providers and offer more of our incredible treatments. We have the latest technology in lasers, regenerative aesthetics, and we are obsessive about educating and training ourselves to do the best. So I want to be the best and the safest.
It's a great goal. It's a great vision. Now,
Yeah.
Aleta, what is the most important piece of advice you can give to someone who's thinking about getting some type of aesthetic treatment, aesthetic procedure done, but isn't sure which provider to choose?
I think number one, when you choose a provider, you need to see their before and afters, their personal before and afters. If they can't produce before and afters, they're not working hard enough to produce those before and afters. I think that having before and afters is concrete evidence that they're trained enough to achieve those results. Because again, most patients are, I didn't get results, I didn't get results, I didn't get results. So I think when a patient is going to see a provider, that you shouldn't, number two, you should not be dictating and telling them what you need. You should have a full facial evaluation by a provider, set up a plan, and take that plan and address what bothers you most. And if it's your chin that bothers you most, that might not be the proper way to rejuvenate your face. And you have bad skin and flat mid face and sunken temples, but you can educate your patients. You should be told, listen, if I do this, this is not going to look good because you're going to be full on your lower face and flat in your upper face. I think a full facial consultation should be utmost and include skin, dermis, and bone. And I think before and afters of whatever procedure you want, because I have a Helix CO2 and I had a Tetra before that. No one but one other provider had that device here. I bet you there's 12 to 13 devices around me. But these practitioners can only do minimal levels that they were given by the company. None of them can perform any close to the degree of laser results that I can, but they're all advertising that they have this laser and they can do CO2. So why don't you ask for those results? So it's not the device and it's not the needle, it's the provider pushing that needle and it's the provider pushing that pedal that gets you the results. And I already know that there are people that have the same devices as me and do not even understand the technology, cannot push that device to truly get you the results that you want.
Got it.
Before and afters, full facial evaluation, and before and afters, and how many have you done?
Perfect. Great advice. Now, Aleta, I have one last question, but before I ask it, I do want to point people to your website at unitedmedicalandaesthetics.com. Now,
Yes, sir.
the question is, what does beauty mean to you?
Beauty, oh gosh, I think your personality, hands down, your smile and being kind. I see some beautiful women and they are bitchies. They're just grumpy, never happy, stressed. And I think beauty definitely comes within. I do. So I think a smile, and I love my patients who have wrinkles because they've smiled so much. I mean, I have to tell them to stop smiling when I try to do their photos. So I think beauty to me truly is your personality. I
Awesome.
really do.
It's a
I
beautiful.
always say to give your face something to do, smile. So I even did a post on my Instagram about all the benefits of a smile.
Awesome. Well, there you have it. Aleta is sharing her expertise. Now,
Yeah.
Aleta, where can people contact you and your practice?
Yep. So we're at unitedmedicalandaesthetics.com. And my Instagram, which is up to date almost daily, is my name, Aleta Sloan, the PA. So it's ALETA SLOANTHEPA. So Aleta Sloan, the PA. And we do a lot of education on there. And I think I have over 1,100, 1,200 posts.
Wow.
And then it's unitedmedicalandaesthetics@gmail.com. And if you go to my Instagram, there's links up there for my courses on resurfacing, particularly the CO2 with Tetra, the Tetra CO2 with Cartessa, and the Helix.
Awesome. Okay. Well, Aleta, this is
Mhm.
awesome. This is amazing. I think you dropped some amazing knowledge here on this podcast. So thank you for coming on and sharing your message and sharing all your information.
Awesome, Daniel. Thank you for having me. It was wonderful. Thank you.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.